The sympathetic nervous system and the renin-angiotensin-aldosterone system are lovebirds. Okay, I call them the two main lovebirds of hypertension. You are a vampire and you taste the blood of someone whose renin-angiotensin-aldosterone system has been activated. You realize that it is salty. And remember, this is just a hypothetical scenario. I didn't say go and drink anybody's blood and taste it too. No, that's not what I said. Hi everyone, you're welcome to Dr.MiraTeaches. This is the third video within the hypertension series. In the first video, we looked at what blood pressure was. Then, in the second video, we went into the details of the blood pressure equation. And now, we will be looking at the pathophysiology of hypertension. And it's going to be very fun and interesting. We just want to ask ourselves the question, why does a person's blood pressure go up? Okay, so that's the question we are answering in this lecture. Okay, now this is just a recap. We saw this in the blood pressure equation video, that blood pressure is equal to cardiac output times systemic vascular resistance, and cardiac output is equal to heart rate times stroke volume. And I even gave a mnemonic that will help you to remember. We said B and P came out as survivors. They came out of a heart attack and stroke. So BP is equal to cardiac output times systemic vascular resistance, and cardiac output is equal to heart rate times stroke volume. If you are lost, the previous video on the BP equation will make it clear to you. And also there is a short video within the shorts playlist, so you can take a look and then refresh your memory. All right. Now, what you must know is that any factor that will increase any element of the BP equation will lead to an increase in blood pressure. That's why it's important that you know the blood pressure equation, because it forms the basis for understanding what hypertension is all about. Okay, any factor that increases any element of the BP equation, whether cardiac output or systemic vascular resistance, will lead to an increase in your blood pressure. So you need to know the blood pressure equation in your heart, mind, body, soul, and spirit. All right. So an increase in cardiac output, okay, will definitely lead to an increase in your blood pressure. An increase in your systemic vascular resistance will definitely lead to an increase in your blood pressure. Okay, if you increase both cardiac output and systemic vascular resistance, you're going to increase your blood pressure. All right, so it's either you increase one or both. In whatever case, whatever you do, anything that increases any element of the BP equation will increase your blood pressure. And I put this at the bonus slide of the previous video because I wanted to tease your minds and your hearts and your taste buds for the pathophysiology video, which is what we are doing currently. Okay, and I told you that the two main drivers of hypertension are the sympathetic nervous system and then the renin-angiotensin-aldosterone system. The point is that if you take a very good and critical look at how a person's blood pressure will go up, you realize that it sort of boils down to either the sympathetic nervous system or the renin-angiotensin-aldosterone system. Of course, you need to also consider the components of the BP equation. All right. So we'll see how that plays out in the following slides. Okay. So the sympathetic nervous system increases blood pressure by increasing your cardiac output and your systemic vascular resistance. And the renin-angiotensin-aldosterone system also does the same thing. It increases your blood pressure by increasing your cardiac output and increasing your systemic vascular resistance. So whether you are dealing with the sympathetic nervous system or dealing with the RAAS system, okay, you are increasing both cardiac output and systemic vascular resistance, and these will lead to an increase in your blood pressure. All right. Now, the sympathetic nervous system and the renin-angiotensin-aldosterone system are lovebirds. Okay, I call them the two main lovebirds of hypertension because once you activate the sympathetic nervous system, the renin-angiotensin aldosterone system would also be activated. Okay, and once the renin-angiotensin aldosterone system is activated, it will further potentiate the sympathetic nervous system. Once you potentiate the sympathetic nervous system, it will also further activate the RAS, and then the cycle will continue. Okay, so that's why they are lab bits. Anytime you activate your sympathetic nervous system, RAS will be activated. Anytime RAS is activated, RAS will activate sympathetic nervous system, and then the cycle will just go on and on and on. And we call that a positive feedback mechanism. One leads to the other, and that other leads back to the other, and then it goes on and on and on again. So they are love beds. Okay. So anytime a person's sympathetic nervous system is activated, remember that their RAS would also be activated. And if any time someone's RAS is activated, remember that the sympathetic nervous system would also be activated. Okay, because they are the two main lab beds of hypertension. We saw this picture in our previous video where we saw that increasing your cardiac output, okay, that's the amount of blood that comes out of the heart in a minute, and increasing your peripheral resistance, okay, your systemic vascular resistance will lead to an increase in your blood pressure. And we see that the sympathetic nervous system and then the renin-angiotensin aldosterone system both increase your cardiac output and also increase your systemic vascular resistance, so increase your blood pressure. All right. And we saw this as well. We defined what systemic vascular resistance. We defined it as anything that will oppose the smooth and quick flow of blood. All right, that is systemic vascular resistance. We saw these three as the main drivers of systemic vascular resistance. But I told you in the previous video that we usually center around the diameter of the artery. That if the diameter of the artery is very small, you increase your systemic vascular resistance, because now the heart has to work harder to get blood moving through a very narrow area. All right. Okay. So if the internal diameter of the artery is very small, that means that the heart has to work harder. Blood cannot move in very quickly and smoothly like we want it to. Okay. All right. And both the sympathetic nervous system and the renin-angiotensin aldosterone system increase your systemic vascular resistance by causing vasoconstriction. So that is how sympathetic nervous system and the renin-angiotensin aldosterone system increase systemic vascular resistance. Remember, they increase both your cardiac output and your systemic vascular resistance. Okay, but the way that they increase systemic vascular resistance is by causing vasoconstriction, by reducing the internal diameter of the artery. Once you reduce the internal diameter of the artery, that is in vasoconstriction, you'll increase the systemic vascular resistance. So that's how they do it. Both of them increase sympathetic nervous system. Both of them increase your systemic vascular resistance by causing vasoconstriction. Okay. However, what you must notice that they do not increase cardiac output the same way. So the sympathetic nervous system has its own way of increasing cardiac output, and the renin-angiotensin aldosterone system also has its own way of increasing cardiac output. Okay, so let's recap. Both the sympathetic nervous system and the renin-angiotensin aldosterone system increase both your cardiac output and your systemic vascular resistance. They increase systemic vascular resistance the same way by causing vasoconstriction. However, the way they increase the cardiac output is different. They work using different mechanisms to increase your cardiac output. How does your sympathetic nervous system increase your cardiac output? If a lion suddenly appears within your space, you have two options. It's either you are running away or you are fighting the lion. All right. If you run away, your sympathetic nervous system will come into play. If you are going to fight the lion, your sympathetic nervous system will also come into play. Okay. What does the sympathetic nervous system do? The sympathetic nervous system is known as the fight or flight response system. Anytime you are scared or anytime you have to, fight, your heart beats faster and harder. You realize that in these moments, in moments where you are afraid, you realize that your heart is a bit louder than usual. You hear your heart beating faster, it's stamping really loudly and very, very hard. Sometimes it's so bad that it's as though your heart wants to pop out of your chest. Okay, so that's what the sympathetic nervous system does. So whether you are running away or you decide that you are going to be a Samson or David, okay, to fight a lion, your heart is going to beat or stroke faster and harder. Okay, that's what is going to happen. So that's what the sympathetic nervous system does. It increases your cardiac output by focusing on your heart. What does it cause the heart to do? It causes the heart to beat or stroke faster. And it's not just about the heart beating really fast, it also makes the heart to beat harder. All right, so that you can have an increase in your cardiac output. Okay. Now, remember the BP equation. BP is equal to cardiac output times systemic vascular resistance. And we've looked at systemic vascular resistance. All right, let's look at cardiac output. We have seen that the sympathetic nervous system increases your cardiac output by causing the heart to beat faster and harder. When the heart beats faster, it increases your heart rate, all right? And when the heart beats harder, it increases your stroke volume. Now, let's make this simple. Imagine that the heart was a bottle of ketchup, all right? Ketchup in a plastic bottle that you can squeeze, all right? Give two people this ketchup bottle and give them a time, okay, let's say 1 minute, and tell them that they should squeeze the ketchup bottle a number of times. You tell one person, just squeeze it a few times, not too fast, just take your time and squeeze. And tell another person that squeeze several times as fast as you can, okay, within a space of 1 minute. You realize that within the space of 1 minute, the person who squeezed the ketchup bottle several times will have a lot of ketchup out of the ketchup bottle as compared to the one who squeezed very slowly. Okay, so that's what happens when your sympathetic nervous system is activated. Your heart squeezes or pumps faster. So you have a lot more blood coming out of your heart as compared to if your sympathetic nervous system wasn't activated. All right. So that's one aspect of it. So we've looked at speed. Now let's look at contractility when your heart beats harder. Now, with the same scenario of the ketchup bottle. Now let's give this ketchup bottle to a baby. All right. And give another ketchup bottle to someone who is very strong, like a boxer like Bokum Banku. All right. Bokum Banku is very strong. Okay. He's a very strong Ghanaian boxer. So if you put ketchup in Bokum Banku's hand, okay, and then in the hand of a baby, let's say a 1 year old, and tell them that they should squeeze the ketchup bottle, you realize that Bokon Banko is going to squeeze harder than the little baby. The little baby may squeeze and get some ketchup out of the bottle, but it wouldn't be much ketchup out of the bottle. But Bokon Banko will squeeze so much ketchup out of the ketchup bottle because he is stronger. All right. So that's what contractility, the heart beating harder, also does. It squeezes harder, okay, to get a lot of blood out of the heart. So whether you are squeezing faster or you are squeezing harder, you're going to have a lot of heart blood being put out of the heart. All right. And in that case, you increase your heart rate and you increase your stroke volume, ultimately leading to an increase in your cardiac output. All right. So once you increase your cardiac output, you're going to increase your blood pressure. That is why your cardiac output is equal to heart rate times stroke volume. The moment you increase the heart rate and you increase the stroke volume, that is when you increase the speed of um, the heart, and then you also increase the contractility, then you increase your heart rate and your stroke volume. All right, so that's how cardiac output goes up. So this is how your sympathetic nervous system increases your cardiac output. It does so by focusing on the heart. But the renin-angiotensin-aldosterone system is the funny guy. Okay, how does it increase your cardiac output? What is the mechanism, all right, by which your cardiac output goes up when it comes to the renin-angiotensin-aldosterone system? Okay, let's give you a scenario. Now, let's say you had to make salt solution, maybe for a mouthwash or something. Okay. If you put in too much salt within the solution, this is what your face is going to look like. Okay, very, very, very salty. It's when the solution is very concentrated, this is what your face will look like. So what will you do in this case? You're going to pour a lot of water in the cup so that it dilutes it so that it doesn't look salty and you can regain your smile. Okay, your face doesn't look like this anymore. So that's what happens with the renin-angiotensin aldosterone system. The renin-angiotensin aldosterone system tells the kidney that put more salt in the blood. Let's make the blood more salty. So once the blood is salty, the body can't take it. Okay, so water will have to follow to dilute the salty blood. So if you are a vampire and you taste the blood of someone whose renin-angiotensin aldosterone system has been activated, you realize that it is salty. And remember, this is just a hypothetical scenario. I didn't say go and drink anybody's blood and taste it too. No, that's not what I said. I am just saying, okay, this is just a way to help you to remember that once RAAS is activated, the blood gets salty. All right. Once RAAS is activated, the blood gets salty. And wherever salt goes, water must follow. You see. So that's what happens with the renin-angiotensin aldosterone system. If you test the blood of someone whose RAS has been activated, this is the face you're going to get. That's if you're a vampire. But please, I'm not asking you to be vampires. Okay. All right. So what happens is that water has to dilute the salty blood. Okay. So I think it's a very, very, very smart way of increasing cardiac output. And God is so wonderful for doing it like that. I think it's epic. Okay, so that is what happens with the RAS system. There is salt and water retention. Okay, now I just want to give you a brief overview of the renin-angiotensin aldosterone system. Okay, just the basics, just the skeleton, the foundation. All right, once you are able to get the basics for the renin-angiotensin aldosterone system, you'll be able to fill in all the details and it doesn't look as complex as it usually looks. All right. Now, let's look at the renin-angiotensin aldosterone system. I mentioned it again because we are looking at the names, the individual names of the RAS system. So let's start with renin. All right. What is renin? Now, the kidney is also known as renal. If you say renal, you're usually referring to the kidney, isn't it? Okay. Now, a lot of our hormones or proteins, all right, usually end with the letters IN. For example, oxytocin or insulin. You see that it ends with I and N. All right. So the word renin, the hormone renin, comes from renal. You see, so renal hormone, renal protein. So it's just a combination of words. Okay. You see, I like playing with words. It helps you to remember where the term comes from and then what happens, usually with that term. All right. So renal. So renin. So it's a kidney hormone. Okay. So that's the where renin comes from. Okay. So we've tackled the renin aspect of the RAS. Okay. Then we go to angiotensin, which is the first A in RAS. Okay, what does angiotensin mean? Blood vessel. All right. When you hear angio stands for blood vessel. Okay, so that is sorted. Now, tensin. All right, tensin comes from the word tension. You see, so tension. So a tension hormone. So tensin. Remember, we have an IN at the end of the word. So tension hormone. So tensin. So angiotensin, blood vessel tension. So blood vessel tension causes vasoconstriction. Anything that will put tension in your blood vessels will cause vasoconstriction. All right. But remember that we have angiotensin 1 and angiotensin 2. Okay. But always remember, there is a saying that says that two heads are better than one. Okay. So two heads are always better than one head. All right. So angiotensin 2 is stronger than angiotensin 1. So it is angiotensin 2 that does the vasoconstriction. It is angiotensin 2. All right. So remember the word tension. Tension causes vasoconstriction. Remember this, Pastor? It is getting tensious. Yes. All right. So that's how you remember angiotensin. All right. Causing vasoconstriction. When there's a lot of tension, there will be vasoconstriction. Okay. Now we go to the main guy, the guy that does the magic of putting salt in the blood. It is called aldosterone. Okay, the guy is called aldosterone. So aldosterone, there are hormones that end with the letters O N E. For example, testosterone. All right. So we also have aldosterone. Okay, so this is the salt hormone. This is the one that puts the salt in your blood for the blood to become salty. Once you have aldosterone being activated and the blood gets salty, water has to follow, isn't it? So that's just a brief skeleton of the renin, angiotensin, aldosterone system. You just need to remember these three things: renin, angiotensin, 2, and then aldosterone. Once you remember these three, then you can fill in the other details of the renin, angiotensin, aldosterone system. If you cannot remember anything at all when it comes to the renin, angiotensin, aldosterone system, you just need to remember three things: renin, angiotensin 2, and aldosterone. Okay. Renin is the kidney hormone. Angiotensin 2 is what causes the tension within the blood vessels and causes vasoconstriction. And then aldosterone is what puts the salt in your blood. Okay. So we have seen that the kidneys, okay, increases your cardiac the kidneys would increase your cardiac output, all right, because of the activation of the renin, angiotensin, aldosterone system, all right. But specifically, the focus is on aldosterone because aldosterone is what causes there to be sodium retention. Once you have salt being retained, water has to follow for the dilution, okay, so that you can have a good balance. All right, so that is how the renin, angiotensin, aldosterone system increases your cardiac output. All right, it does so by focusing on the kidneys. So this is a summary slide. Okay, now we have seen the BP equation several times. Blood pressure is equal to cardiac output times systemic vascular resistance. Right? We have seen that both your sympathetic nervous system and your renin, angiotensin, aldosterone system would increase your systemic vascular resistance by causing vasoconstriction. So both work the same way, okay, to increase your systemic vascular resistance by causing vasoconstriction. However, the way they increase cardiac output differs. Sympathetic nervous system increases your cardiac output by focusing on your heart, that is, increasing your heart rate and your stroke volume. However, the renin, angiotensin, aldosterone system causes salt and water retention, and that is how it will let your cardiac output go up. In all cases, it ultimately leads to an increase in your blood pressure. You see, it's very simple. So I hope it was very, very understandable. Okay, so until next time, keep learning, keep studying, keep shining, and glow like the African sun. Bye.